Infection occurs when a susceptible person inhales droplet nuclei containing Mycobacterium tuberculosis. These bacilli are able to traverse the mouth or nasal passages, upper respiratory tract, and bronchi to reach the alveoli of the lungs. Once in the alveoli, the organisms are taken up by alveolar macrophages and spread through the body. Usually within 2 to 12 weeks after initial infection, the immune response limits further multiplication and spread of the tubercle bacilli. However, some of the bacilli remain dormant and viable for years. This is known as latent TB infection. Persons with latent TB infection usually have a positive purified protein derivative (PPD) skin test. They have no symptoms of active TB and they are not infectious to others. Latent TB infection is becoming a growing public health concern. It is estimated that 2 billion people worldwide have latent TB. 10 to 15 million of those live in the United States, and about 10% of these individuals will develop active TB at some point in their lives. People who are immunocompromised have a greater risk of progression of latent TB infection to active TB disease. HIV infection makes individuals particularly vulnerable for progression to active TB and to reactivation of latent TB infection. There are several factors that influence the transmission of TB. Factors such as concentration of infectious droplet nuclei in the air, the duration of exposure, and the individual's degree of susceptibility to infection must be considered. Other factors that can influence transmission: active disease in the lungs, airways, or larynx, cough, presence of acid-fast bacilli or AFB in the sputum, smear, or culture, failure of the client to cover the mouth and nose when coughing or sneezing, cavitation noted on chest X-ray, recent initiation of chemotherapy, procedures that can induce coughing such as sputum induction. There are also environmental factors that can enhance TB transmission that include contact with a person who has active disease in a small enclosed space such as a car or office, inadequate ventilation that results in insufficient dilution and or removal of droplet nuclei, recirculation of air such as occurs when windows to the outside are closed and air conditioning is used. It should be noted here when discussing transmission that people have a 50% chance of becoming infected with TB if they spend 8 hours a day for 6 months or 24 hours a day for 2 months working or living with someone with active TB.